can. Just so folks that are listening know, there is some announcements that are supposed to be happening from Governor Nome right now. And I will be having some staff shoot emails and text to me so I can fill the group in. And I know folks are also trying to keep an ear open there as well. Before we go through our roll call, I will tell everybody, just in the interest of time, the mayor and I have a call with the first class municipalities at 3. So if we're not finished, maybe he or I will drop out to start that, but I would think we'd be finished by then. So in attendance today, we have myself, Amy Leone, city manager. We have Mayor Nathan Johnson. We have Dr. Mary Milroy. We also have our ex officios here, City Attorney Ross Denherter, Commander Jason Foote, Community Development Director Dave Mingo, and Community Development Manager Brad Bees. So I have a few things that I would say are smaller housekeeping type things based on emails and requests that we've gotten. And I know the mayor's also asked on us to address how enforcement has gone on our ordinance. And the rest, I think, is slated to be a broader discussion about how we're doing and what's next. So I would let the group kind of suggest what it is they'd like to talk about first, and we'll just go from there.
Why don't we start with enforcement, since I know we're kind of doing this thing, we're waiting to see what the governor might announce and how that might impact our discussion. So that would be a safe place to start.
Sure. So our ordinance has, I think, been very well received. I would say our questions that we're getting about the ordinance itself are starting to ticker down a little bit. We still have occasional questions. We still get occasional comments about specific employers that didn't fall within this ordinance. But I think a lot of the questions have been addressed. I did tell the city commission that we don't recommend any other changes. And since that time, a lot of those specific questions about specific industries, the hairstylists, the tanning salons, that sort of thing has not gone away entirely, but has definitely tapered down. We have had a couple of places that we've had to provide reminders to. And I haven't had a chance yet to talk with Commander Foote about things that happened over the weekend. I know we had one eating/drinking establishment that we are going to have some conversation with in regards to meeting probably the letter of the ordinance, but maybe not upholding the spirit of the ordinance. So we'll be addressing that. But Jason, have you heard anything from your officers on enforcement?
No, we didn't have any calls over the weekend at all as far as enforcement goes. So no complaints or anything from the public on violations or anything observed from the officers.
I didn't entirely understood that, but I think that you said you had no complaints or violations. Is that correct? Okay. So I think folks are understanding where we are, and I think also respecting the social distancing and the group not getting together in big groups. I know from my experiences in the parks this weekend, people were visibly distancing themselves from one another, which is strange since we like to stop and chat when we encounter people in the parks. But I can tell that, that's probably some national education that's going on as well. But I think definitely some of the things in our ordinance may have helped move that to the forefront of people's mind. I still think education is a big part of what we're needing to do here. I think people naturally tend to not stay away from each other. And I know I had a discussion today that somebody said, hey, I'm trying to stay away from people, but as I'm walking away, they're coming towards me. So it's just natural because we're humans to want to be next to each other, but we just have to keep practicing and modeling good behavior. So we're working on that as well. There are some new regulations in regard to face coverings that came out sort of late Friday night and on Saturday from CDC. And we're working internally on those in our organization. We think since we have the language in our ordinance to follow CDC guidelines with respect to social distancing and what they think is good health practices, I believe that we cover that within the language of our ordinance. So hopefully folks are thinking about that and preparing, if not to wear a mask, to have some type of face covering when they're out in public.
Maybe the other issue we should address is I don't believe we had substantial community spread last time we met. That has now changed. We have 18 confirmed cases in Yankton County and substantial community spread.
Yes, and I think that begs the question as to kind of what we've talked about before, what happens next here in our process. What, if anything, happens next? I know the mayor of Sioux Falls has recently put out or is planning to put out a proclamation with a little more strict guidelines. However, I don't believe it's anything more than a proclamation at this time. And we're waiting to see what Governor Noem is about to announce. That might change our trajectory a little bit. But we should maybe think about and talk about what steps, if any, are to be taken, knowing that if the trajectory is the same as it was last week, we're looking at end of May and beginning of June as being the peak period. So probably I've been using, 4th of July as sort of just the tapering off. That's a long time from today. Thoughts or comments on that?
I guess, depends on which prediction you see, but I think we do need to be prepared for it to stretch out a ways.
It sounds like Governor Noem just extended her order until May 31st.
And she also changed all of the shoulds to shall.
Okay. Ross, legally, what does that mean?
It makes it mandatory. Anytime there's an order or a statute or an ordinance that uses the word shall, it makes it a legal obligation.
Well, I would have to go through her executive order then and refresh myself on everything that she has indicated that we shall be doing, and compare it with our local ordinance.
At this point, I'm reasonably confident that what we do is at least as strong as what the executive order has in it.
I agree. I would ask, I would need a little time to do a little homework to double check that, make sure that's accurate. And then also a little more time to reflect on, is that what's right for us right now? Or should we start talking about even going beyond that? We also have to take into consideration keeping people up to speed with all the changes that are happening. I think general public doesn't disseminate between an executive order from the governor and an ordinance from the city commission in the same way we do, because we all understand the different layers and things. I think they just don't want to create confusion there.
Yeah, I think we'll have to see how this executive order sinks in. But in the meantime, I know we've discussed about further measures we might take and a list of essential businesses. I guess I would like for us to proceed with that discussion and seeing how that would shape things if we took another step. So if we determine that we need to, we're ready. Over the weekend, we had both the United States Surgeon General and Dr. Anthony Fauci saying that they think all states should be looking at stay-home orders. And South Dakota, even with this change to the executive order, I don't know that that would put us in that category. So I think, again, as city leaders, we're going to have to do what's best for our community and not depend on anyone else to do that.
What do you think that looks like, Mayor, in terms of, do we start taking a look at other states and seeing what sort of the second step has been? I know we talked about the difficulty when we have a lake population and a greater Yankton population that isn't incorporated or doesn't have to follow our ordinance.
Yeah, it's unfortunate the way that this would play out for us, but that's the hand we've been dealt. When I look at the different definitions, you have, the mayor of Sioux Falls today called his proclamation a safer at home order. Then you have stay at home orders and shelter in place. And I guess I would characterize the next step I would see us going to as a stay at home order type of ordinance. And so most stay-at-home orders limit movement to essential activities like doctor visits, grocery shopping, or going to work for essential workers. Most states allow residents to go outside for exercise if physical distancing is maintained.
Not to interrupt you or change the subject, Mayor, but just so everyone on the call knows here that it looks like Governor Nome is putting in a new order that addresses Minnehaha and Lincoln counties. Anyone over 65 or anyone with chronic medical conditions is directed to stay home for 3 weeks. So she does have a stay-at-home order, it looks like, for those specific counties and those specific populations. However, I'm not the one listening in here, but that's what it's, and I'm getting more texts as I'm talking here, but that's what it looks like. So from the state standpoint right now. And the schools will be closed for the rest of the year.
So, that's where my mind's at. I know we've kind of agreed on what the essential businesses list would be. It's based on the Department of Homeland Security's list, and Ross has set it up so that would be just a matter of inserting that into our current ordinance as a resolution. Is that correct, Ross?
We have the ability to add closures and to further restrict those places not subject to the 10-person gathering rules. So if we specifically want to say you shall not be traveling unless you're going to and from specified limited engagements. So under those circumstances, if we want to be able to tell people you need to stay at home unless you have a legitimate thing you need to do, we'll probably have to do that in the form of an additional ordinance. So that's something for this board to consider, how much additional regulation we want to impose, because the path that we get there will matter.
I would say that whatever we do, we stick as closely as possible to the CDC guidelines, because if we start getting too much into detail about specific activities, there's just, the issue's so broad, there's going to be very little, no easy way, I guess, to get to a point. There's so many things to think about right now with, individual contractors and everything in this time of the year, with what's going on in the construction industry, and a lot of those folks work, out away from others, and so if we do start discussing any additional ordinance language, I'd strongly recommend sticking with CDC advisories or guidelines.
I'd also like to raise the question too, how much more can we do with education? And I'll knock me off my soapbox here, or somebody, cut me off if I need to be cut off here. But I have a lot of frustration, especially when the sun gets a little warmer, that people just aren't understanding that, it's not just don't stand close together. Don't run to the store every time you need something. Make some plans, limit your trips to those essential places. Now isn't the time to get together with family. I mean, I'm hearing a lot of people tell me, well, this is my family. I'm just getting together with my brother or my cousin or my sister. Well, I think we learned from the Glanzer family in Huron that family is you can spread it in a family, and unknowingly is my understanding. So I just too want to make sure that we're pushing the education side, not just from a health perspective, but also so we're not appearing to be just restricting people's freedoms and rights, but also that we're trying to protect public health, because I don't think that message is getting across to everybody. So I'll stop at that.
I'll mention along those lines, we've made an attempt on our social media platforms and incorporated that into our talking points for this week. The Department of Health, South Dakota Department of Health has really stepped up their education efforts on that very topic, talking about families going grocery shopping and folks, the sorts of things you can leave home for. So we're pushing those things out on our digital channels, and I think I'm going to make sure that there's an emphasis on including it whenever any of our folks are talking to the media as well, when we have that opportunity. But there are some really good things being pushed by those resources we've been talking about. So there's some good information coming out of the Department of Health saying that very thing.
We did have a local videographer offer services to us if we wanted to do some public messaging. Would it be worth having Dr. Milroy do some PSAs that we could share that are very much in line with what our state Department of Health is putting out in our Yankton County Task Force?
Yeah, if we can do that. She has some street cred. We don't. But I think that'd be awesome if you want to connect the mayor, if you can connect the two sources. I think that would be great, in addition to whatever it is we do. And certainly I do think as a public entity, Brad, our social media and everyone is doing a great job, as is Paul Scherschlick and his group. It just can't be overemphasized enough. I mean, it has to be just burned into everybody's mind. So we don't have the benefit now of all the school kids coming together, because a lot of times Dr. Kindle can help us with that. But I think also if I could mention to him, if there's something he could get teachers to talk to kids about, because I think when that happens, kids talk about it with their families, and that starts conversation. But I'm getting a little sidetracked here, but I did want to mention education. Should we give ourselves some homework and take a look at Mayor Tenhanken of Sioux Falls' proclamation, do a little reading on what Governor Noem discussed this afternoon, and take a look and see what other cities have maybe put together so far?
Yeah, I think what might be helpful for like Mary and I especially, is if Ross and Dave and Jason could put together some scenarios for us based on what you've just described, Amy, and talk about, well, what are going to be the enforcement issues with that? Why do you think this would be a good or a bad option? Just so we can keep that in mind as we are trying to set what we think is the best health policy for the public health policy for the city, because we definitely want to take those things into account as well. Dr. Milroy, would that be helpful to you?
Yeah, I think that'd be fine. I'd be happy to work with you on that and the videographer. And I guess I was wondering, do you think even just writing a short piece to put into the P&D or Observer or something like that, if there are people that maybe like the print media too, if I just wrote up a little something and I could send it and see if you guys have thoughts or additions or corrections, whatever. I could work on that today and kind of see what I could get as far as a short piece. Maybe they'd put it in just as a kind of a public service message.
I think that's a great. Oh, sorry, Amy. I was gonna say, I think that's a really good idea in part because I have a fairly decent idea of what our reach. We're reaching 40 to 50,000 people a week, which is not unique. So I should say we probably reach about 14 or 15,000 unique folks from our social media platform. Lately, that's up quite a bit from what it's been traditionally. But I know our audience tends to be older than high school age students, generally older than college age students, but younger than senior citizens. So our audience tends to skew a little bit female and mostly working age. That tends to be our audience, and it's primarily a Facebook audience. We have a Twitter audience, but it's much smaller and less interactive. But I think the folks who might rely on print media or be more used to print media might not be an overlapping group that we necessarily get a lot of traction with from the digital media side, I should say.
And if we need to, we can certainly pay for, if they won't run it as a public service or as a letter to the editor, we can certainly pay for media spots as well in the sense of this is a extension of a work on a formal city committee. Jason, do you have any sense about, I know I asked you this before, do you have any sense on enforcement, how that what that looks like on a stay-at-home type order? I mean, I just saw, Governor Noem's 65 and older stay at home. Well, I don't know. Are you going to make those people stay at home?
Home order, especially when we also allow them to go out in the public for exercise and things like that. Maybe if you start talking, I don't want to say it a lot.
Dave, is there just dealing with I can't even count how many contacts there are. We had 10 days. We're all learning new examples of things every day when people call with questions, and it's awesome that for the most part people are calling with questions, clarifications, with the ordinance as it's currently adopted. If Commander Foote a little bit, I think, we're telling people to go outside, but yet we're telling people to stay home. There's still pushing hard on the circumstances of, somebody that could maybe go to work and they work alone outside, but yet we'd be telling them to stay home. Yeah. So even if they're not deemed essential, they're outside, not essential, but it's somebody outside alone on a mower and they're mowing somebody's yard who can stay home, who can then stay inside. There's just so many variables. A next step to me seems, if there is one, it seems more of an advisory than another ordinance amendment, unless I'm just not reading the community right at this time based on the questions we're getting.
Yeah, and you may be right on that, Dave, considering the enforcement difficulties that are inherent in these types of police that in a realistic way, in a meaningful way. So, yeah, I think that's a discussion worth having.
I think if you get good community buy-in, you'll start getting peer pressure from other community members too. So I do think coming out with a strong advisory is a good way to go about it. And then with information education, I think you're going to start finding other community members start to say, hey, would you cut that out? You know, recognizing, hey, this could be a danger to me, my family, my community, my friends. And that's how it'll work, is if you have peer members say to you, or somebody, a member of the community say, hey, would you stop that? You know, that works better than a ticket, I think.
What do
I
you
also
guys think?
Sorry, Amy. I think along those lines of peer pressure, I know that our major grocery stores are rolling out some new rules that match really consistently the recommendations that we're giving anyway. So maybe I'm a little Pollyanna on this topic, but I do think we're on the upswing of education and compliance. We're noticing things that aren't great, but we're seeing folks like those grocery retailers taking those advisories on board and setting some rules of their own. And I think as people see these, you know, there's really very few places left someone would go where they're not going to see a sign or be told by someone, hey, we're not open to the public, or if you come in here, here's how it works. So I think we're on the upswing of people being aware of it both nationally and locally.
Thank you, Brad. The question I had is, what do you guys think about, we have a commission meeting on Monday, putting together a proclamation. I mean, that's what Sioux Falls did, that has stronger language and its recommendations versus an ordinance, but has a little stronger language? Or do we just stick with the route of more education on the ordinance we have and take that as a future step? We do have a lot of weeks here to work with this, I think. But you know, the other thing is, where do we, if we do that as a proclamation, if we had to, we could add another layer of seriousness if necessary, I suppose.
I like the idea of a proclamation. You know, I think that that's something that would be much easier to do than go through a new ordinance. And, you know, with the change in the Yankton County status, I think that a proclamation would follow, you know, real logically from that. So I guess I like the idea of a proclamation.
Maybe we just put the trust in our community, Mayor, that we trust that they're going to do this. We trust that it's important to them as it is to all of us. And maybe we can do some social media campaigns as well, or other campaigns with, you know, various people throughout the community talking about how important it is for all aspects of our health.
Yeah, that sounds good to me. You know, we're just going to be in this difficult place where cities across the state might be doing different things, and yeah, there'll be a lot of confusion, and we'll just have to try to educate to bring awareness. You know, the governor released the new modeling projections on Friday, and they're projecting anywhere from 1,300 to 7,900 deaths in the state in the next several months. So I think it's really important that we stress to our citizens that they can make a difference in that outcome.
Well, I've heard that in that pink bin behind Ross, that he's got all kinds of proclamations waiting to be vet it out. So I'll share with him some language that I have from Sioux Falls and see if he can find one in his file back there. Ross, do you think he could help with language if we got you some stuff from other cities?
You bet. And I can also hook you up with a clown costume. I think I saw that in that pink tote too.
I don't need one of those. I'm sure everyone would agree. But
Yeah, that's too
what
much
maybe
information, Ross.
what we could do is maybe have that and take a look at it together on Thursday as a group and talk about some language there and then get it ready for, I'll talk with Colleen. It could be ready for the commission meeting on as early as, Friday or Thursday night or Friday morning, and I'll have it on the agenda. And maybe what I'll ask the commission is for a vote of supporting that proclamation. That's gives it some teeth too, I think. I think that's a good plan. I have a few other questions to bounce off of you all as it pertains to some various things throughout the community and COVID-19, if we're ready to move on from there. Or Ross, did you have something to add?
Nope.
Okay. I think I know where we are with this, but I just wanted to reiterate, Todd Larson has talked to me about the fact that now the nights are getting a little bit warmer, and Jim Snook, our Parks Maintenance Director of Parks Maintenance, is ready to open bathrooms. And he just wanted the health committee's blessing or reassurance that if bathrooms are left open, well stocked, well cleaned, frequently cleaned, that this was something we wanted to do, is open those. We do need to have them open for our employees that work in the parks, but I think we talked about having them open for the community use as well, so they can wash in, wash out.
I think it'd be a wise idea to mount some signs reminding people you can wash your hands here. Invite people in specifically for that purpose.
Yes, and we also talked about some signage and some social media promotion about, our parks are open, use social distancing, and, they're at your own risk, hand sanitizing, etc. So I will talk with Todd Larson and Jim Snook about those things. The second is more of probably directed at Dr. Milroy, but for everyone else, it's sort of consensus. I'm going to be working with our staff, so people are going to see some changes when they interact with our staff or they see our staff in town, and that's as it pertains to face covering. I think we heard this weekend that face covering is probably more important than either they initially thought, or that it's now more recommended with more spread. I'm not sure what's driving that, but I do want to start having our folks, when they're interacting, make sure they're using face covers. Now, we don't have masks, so to speak, and we know we want the healthcare providers to have the masks that are available in our community, but we are going to be utilizing some cloth face coverings, and just what you guys are hearing about that, what your thoughts are on that, if you think that's good practice, etc.
I think that was the current recommendation, is when you're out and about, you should have your face, you should be wearing some type of a mask, whether it's homemade or whatever. And I think there was a pretty strong recommendation to that. And so I think we should all be setting a good example, because if we say that and we're out in the community and people see us and we're not doing it, that sets a very awful, then it's like, do as I say, not as I do. I think that we should encourage it. I think we should encourage all the city employees and people who represent the city to follow that rule too. In that's part of education and getting buy-in. If we say, hey, listen, this is the new recommendation and we are doing it and we think you should too. I'd say that, but I definitely think we should.
Well, we'll look for you to have one on, Dr. Milroy, when you do your first video there. But we're going to be utilizing some homemade masks. We have some staff that's on hand that have the ability to make some masks, and they can do some work from home for us to do that. Fortunately, they're willing to do so. So we're going to take that route until that supply becomes more available. But I think that's important for us too, not just to protect ourselves, but as you're saying, sort of lead the path to have people see what a best practice is doing. And I know in our building, you can see a couple of our employees there. They're in their own confined workspaces that have closed doors, and they're not with anyone else. But I know that if Dave is out in a common area, even though he's 10 feet away from people, he's got a face covering. So.
I think it might also be prudent to recommend to people, if you don't have a mask or you don't know how to make one yourself, there's lots of people out there that do know how to make them and are volunteering to make them for friends. So don't hesitate to ask people that have them, hey, how'd you get it? Can you hook me up? I think that people need to be their own best advocate. We ought to encourage them to track something down if they don't already have a good mask solution.
Mayor,
Right.
Go ahead, Brad.
Brad
Brad and I are interrupting each other a lot today. Go ahead.
This is just the day I talk over you. I'm sorry about that. Along those lines, because I suspected this was coming, we've pushed out on our social media channels the information about face coverings, as well as links to those videos that I'm sure everyone has seen already. The Surgeon General and other folks describing how you can make one without sewing, if that's somebody, if like Ross said, you haven't found somebody to connect with who's a good sewer. I think the upside of this is a nationwide movement. I'm seeing this information on TV. I'm seeing advertisements. We're repeating the same message rather than creating a new message for Yankton. And I think it's good when we can create a connection to people here who are supportive. But I think there's also a real benefit in saying we're doing the same thing everyone else is doing everywhere. Here's trustworthy sources telling you this is okay. So they can access the CDC, they can see the Surgeon General. So there's also an intentionality of using the same terminology and messaging that folks are across the country as well.
Yeah, agreed. I like that a lot. I can't remember, Mayor, if you're still the president of the Community Relations Board at the federal prison camp. I'm curious. I'm wondering maybe if we help them out with supplies, if we could ask the inmates there to help us out with assembly. I think they have access to sewing. If that would be an idea that could help the effort.
Yeah, it's a good idea. Especially since they haven't been allowing prisoners to go out into the community to do things. They might be looking for things to help.
Are you still president of that board, or is that somebody else now?
I am, so I can reach out to the warden's office.
I think if we both hit them from other ends, then maybe that will be helpful. Because I think there's probably a lot of folks who, especially senior citizens, who might not have the, ability to do some sewing. We could do some distribution, and I'm sure we could find with some approval, some funds to help with materials if they need that. I think that about wraps what I have on my list up. Are there any other topics prior to us going and doing some homework that you guys would like to talk about?
As far as the education piece, Brad, will you be working with Dr. Milroy to create some talking points for messages? And I've got the number of the person who volunteered to help us with that, if you want me to connect him with you.
Sure, that'd be great. I have a set of stuff I've been working on for this week anyway, and I've added a few things, and I can shoot some stuff over to Dr. Milroy, and she can decide what I've written is good and what isn't as good.
Perfect.
That sounds good.
And Ross, maybe if you're able to work on a draft of a proclamation, if we could all take a look at it, maybe Wednesday afternoon or something, if that gives you enough time. I think the Sioux Falls one is a really good one to work off of.
That would be my plan, and I think that time frame is fine.
Anything else? If not, I would ask either the mayor or doctor to give me a motion to adjourn the meeting, and we'll reconvene on Thursday.
I'll make the motion.
And I will second it.
Okay. All those in favor signify by saying aye.
Aye.
Aye. Pose same sign. We will see you all Thursday. Thank you very much.
Okay,
Thank you.
thanks. See y'all.
Bye.
Yep, see you Thursday.